medication versus actual therapy in regards to ADHD, PTSD. And you know what? First responders are discussed on this channel as well. So let's talk about ADHD, the short term relief versus the long term solutions. Let's get down to business. Enough BS. I'm going to smack the bee's nest as hard as I possibly can. Let's talk about stimulant medications, such as methylphenidate. This is commonly used. Let's face it, this is commonly prescribed for ADHD. And you know what? There's people that say that it's demonstrated the effectiveness in reducing the symptoms in the short term. However, the studies also indicate that the benefits may diminish after discontinuation. So, for instance, you could look at the actual study. A study found that much of the benefit of stimulant medication disappears after the medication is ceased. You could see this article directly at PubMed. ID 166-23654 is the article number right there. Now, outside of that, let's talk about cognitive behavioral therapy, CBT as it's called, right? It's functional, it's useful, I like it, it's got its place, right? But let's talk about how it's actually emerged as a promising alternative or an adjunct to medication for ADHD. So we could take a good hard look, or what I call a meta-analysis, indicates literally that CBT for adults with ADHD was effective in reducing both core and emotional symptoms. PubMed ID 3679477 to be exact. Moreover, cognitive behavioral therapy has been associated with improvements in depression, anxiety, self-esteem, and of course, quality of life. Now let's talk about PTSD. We're going to step into the first responder zone, and we're going to move directly into PTSD, evaluating the treatments and modalities, starting off with Big Pharma's concepts, right? So let's talk about selective serotonin reuptake inhibitors. That's just a long term for SSRIs. And you know what? It's the first line. It's the first line approach or treatment approach for PTSD. Literally, it is the first line attack towards PTSD. While it can be effective in the short term, the long-term efficacy is variable. It starts to shift.